So chronic sinusitis is the most common chronic illness in the United States, even more common than arthritis, believe it or not. And so many people suffer from chronic sinusitis. Chronic sinus disease or sinus symptoms, which include headache, frontal headache, midfacial pressure, nasal congestion, posterior nasal drainage, and of course the associated infection, is pretty common in Northeast Ohio and particularly near the Great Lakes, although it's common throughout the country as well. Many people come in with these complaints, mostly talking about nasal congestion, midfacial pressure, and drainage. The drainage can be positional, worsened at night so that people will cough or feel like they're swallowing a lot of mucus, which may bring them in only to find out that the essential cause is a chronic low-grade infection. Sometimes these infections become acute, and so they may percolate along for quite some time, and then suddenly, because of the influence of a virus, say a cold, or allergies at different times of the year, the lining of the nose swells, constricting the openings to the sinuses, and then there's a backup of these fluids, there's pressure that forms in the face and forehead, there's significant nasal congestion, and just a generalized feeling of fatigue. This would be the most common presentation for patients with sinus disease. Patients who present to our office with potential sinus disease, we're looking for a variety of things. Firstly, they should have symptoms that are consistent with sinus disease, such as facial pressure, nasal congestion, drainage, frontal headache. But these don't necessarily indicate they have specifically sinus disease. The sinuses may be involved in other processes. For instance, they may be presenting with a primary allergic problem. And particularly at certain times of the year, we see seasonal allergies playing a role. Although allergy exists throughout the year, including the winter, when dust and to some degree molds may be playing a role. There can be also direct irritant effect causing swelling of the lining of the nose and sinuses, and a condition known as vasomotor rhinitis, where the lining swells in response to weather changes and barometric pressure shifts. So to differentiate these things, we take a close look in the nose while the patient's in the office. We will spray a numbing medication into the nose and use our own little rigid scope to painlessly look at the lining of the nose and the openings of the sinuses. From this, we can determine if there is evidence for infection, evidence for allergy, or perhaps evidence for direct irritation. And from that point, we can determine the proper course of action. If the patient has an acute sinus infection, we can treat them with antibiotics, decongestants, and saline sprays. Sometimes, if we think it's influenced by allergy, we can also start a patient on a nasal corticosteroid spray and an oral antihistamine. If this has been a recurrent problem, where the patient may be presenting having been treated by their primary care physician on several occasions, we may choose to get a CAT scan of the sinuses, and when the patient follows up in a few weeks, we'll go over the CAT scan with them in the office, where we have the capability on our computer system to display the CAT scan and go over it with the patient to help instruct them as to what the problem may be. If the CAT scan demonstrates a significant amount of chronic sinus disease, such as cysts or polyps in the sinuses, or chronic thickening of the major sinuses, then that patient may be a candidate for surgical intervention with functional endoscopic sinus surgery. If that doesn't exist, we can identify an underlying cause, whether it be allergy, irritant effect, and try to give them medication that can help prevent the recurrence of sinus infections in the future. So there are many patients in northeastern Ohio who have sinus disease, who get recurrent sinus infections, and are treated generally with antibiotics and decongestants. But a small percentage of those people continue to have problems over the long term. In those people, we often will obtain a CAT scan of the sinus, which will demonstrate the disease or chronic infection state, and from that determine if sinus surgery will be helpful. If the patient can be benefited by sinus surgery, we generally recommend a type of surgery called functional endoscopic sinus surgery. This is a type of surgery which is minimally invasive and utilizes telescopes, which we use in the nose to identify the specific chronically infected air cells of the sinuses and remove those diseased areas, as well as open the drainage portals to the various sinuses. This is done in a fashion that reduces the amount of downtime for the patient, reduces the amount of postoperative difficulty and bleeding. Most of the time we do not need to use packing, and the patient will go home about an hour and a half after the surgery is terminated and recover over the subsequent few days. Many times they can go back to work in 4 or 5 days. The success of this surgery is significantly better than the surgeries which preceded that historically, because it focuses on reestablishing normal function. So when we're done, in many patients, we obtain a more normal physiology. The sinuses function more properly again, and we can establish essentially a cure in a certain percentage of patients. Of course, there are some in whom we get benefit, improvement in the way they feel, the number of sinus infections, the headache and pressure that they often feel in the midface, but don't totally resolve the problem. In most patients today, we use a navigation system while we're doing functional endoscopic sinus surgery. And this is a system in which a computer is able to get the data from the CAT scan and display it in real time. And then we have a marker on the instruments we use, which allows us to follow the progress of the surgery by identifying disease in real time that's present on the CAT scan. So as we move the instrument back and forth, the CAT scan pans back and forth, and we can see if we've gotten every last bit of disease. We can see where we are relative to important areas that we want to avoid damaging. And this has been a great advance in the approach to sinus surgery, namely computer-assisted navigation. We also have another technique that's relatively new called balloon sinuplasty. And in this technique, we use a catheter while the patient's asleep, in most instances, which we pass into the passage which drains the frontal sinus or the maxillary sinuses in the cheeks. And this then, when the catheter is in place, we're able to inflate the balloon and pull it slowly back out, which dilates open the passage and allows free flow of normal liquids from the sinuses into the nose. This has also helped avoid doing any intrusive intervention, removing any bone or air cells or even thickened mucous membrane or lining. So this has been a nice advance. We can do this under local in the office in some patients as well. Even though acute and chronic sinusitis is more common in adults, it does occur in children. In children, though, the cause is often somewhat different. In many children, allergy can be an inducing cause, and so in August, when the ragweed and mold gets high, certain children will start having sinus symptoms. These sinus symptoms can also lead to ear infections in children, which is uncommon in adults. We also see chronic adenoiditis. Adenoids are lymphoid tissue, much like the tonsils, which are positioned behind the nose and are at the junction of the back end of the nose and the eustachian tubes that drain the ears. So chronic adenoiditis can result in both sinusitis or a sinus infection, often in children indicated by nasal congestion and a lot of mucus that they're either swallowing or that you see that they need to blow out of their nose. And And at the same time, because of the proximity to the eustachian tube openings, the children can develop fluid in their ears and ear infections, which may be the presenting symptom. So one may be coming in with their child having an ear infection when in fact the essential cause is chronic adenoiditis, and they may have an associated sinus infection. In children, we generally don't do sinus surgery except on rare occasion. Usually we can get them to resolve using antibiotics and decongestants, nasal saline sprays, and a conservative approach. This differs in adults, as many adults have had chronic sinus infections for many years and have structural problems. In children, those structural problems usually are not present.